Welcome back to What in the Health with your co-hosts Fatiha and Rena. Today we have the absolute privilege of having Dr. Angela Fusaro on our podcast today to talk about telehealth. Specifically, we want to talk about what telehealth is, how it has changed patient-physician interactions, especially since COVID, and what the future holds for telemedicine. Dr. Angela is an emergency medicine physician who established herself as a national leader after becoming a member of the board of directors for the Emergency Medicine Residents Association. Dr. Angela worked as an emergency medicine physician at Emory University and is an MBA Goizueta Business School graduate. She built a software platform to estimate patient risk for opioid misuse and overdose. Dr. Angela is also co-founder of Insight to Innovation, a national workshop that helps other physicians translate clinical insight into marketable products. Dr. Angela co-founded Physician 360, a company whose mission is to empower patients by providing tools to diagnose and treat urgent care conditions at home. Thank you so much, Dr. Angela, for taking the time to be on our podcast.
Thank you for having me.
All right, before we get started, it's a pleasure to have you on the show, Dr. Angela. We'd love to see how you're feeling. So on a scale of 1 to 10, how are you feeling today?
I would give my morale score an 8. Feeling pretty good, but it's a little cold here in Atlanta today, and I'm a delicate flower in the cold, so that's why I'm not giving it higher than an 8.
Yeah, wow. Well, it's a very high score given the temperature changes. I can promise you it's not any better in Baltimore right now. So as we kind of set the stage of the conversation around telehealth and telemedicine, we want to give our audience a proper foundation of what the topic entails. So I first want to ask you, what is telemedicine and or telehealth? Are the two terms any different from each other?
Yeah, that's a great question. Telehealth, I would say, is the broader umbrella term to encompass telemedicine and then any other, use of technology within the bounds of healthcare. Telecommunication via technology has really been happening for a very long time. If you think about just the fact that the telephone in and of itself is part of, technology and telecommunication. But I think nowadays when people speak about telemedicine in specific, they're envisioning that, HIPAA compliant Zoom interaction, if you will. So they're envisioning a medical professional on one end and a patient in a other remote place, and them connecting through the use of real-time audio video for the sake of the patient receiving direct medical care. I think that's probably the most common colloquial understanding of what telemedicine is.
All right. And we're also interested what makes telehealth and telemedicine unique from other forms of care. So how would you say it's different compared to like an urgent care or an emergency department?
There are parts that are similar and there are parts that are different. So the obvious, with telemedicine, the patient and the provider are typically in different geographic places. You don't have the same brick and mortar infrastructure of walking into an emergency department or an urgent care. The staffing requirements are different. Traditionally, an in-person visit and care experience is going to require a lot more from a staffing perspective, from a physical device and infrastructure perspective. The insurance coverage might be different. We are still kind of catching up from a billing and regulatory perspective. So an in-person visit for something as simple as, say, strep throat might be covered by your insurance, whereas a telehealth visit might not be. And I think those are some of the most obvious differences. But I would add that the goal of a strong telemedicine platform is to be able to recreate all of those traditional in-person elements, but in a way that leverages technology. So the actual user experience in a telemedicine encounter should be very similar, right? There should be some component of administrative intake. There should be a component of data gathering. There should be a component of privacy, and there should be a trust and a rapport established with the doctor. So there are elements that really should be the same. That's the ultimate goal.
Yeah, thank you for that clarification. I know earlier you were mentioning that telecommunication as a field has been growing and evolving for a while now, but within telemedicine specifically, when did that first start growing as a field, or really what needs or problems led to telemedicine growing as fast as it is right now?
I am not 100% sure on the history of telemedicine. If I had to guess, some of the fields and specialties where we saw it earliest were probably radiology, where you're sharing, a static image related to someone's healthcare with a consultant or with another hospital system that is in a different physical place. So I'm sure that version of telemedicine has been going on for quite some time. I think when we start to talk about traction as compared to early adopters, that transition really happened, at least from my perspective, in COVID. I think that pre-COVID, telemedicine was seen as very optional. It had the vibe of being very concierge. This is something that you might have with your doctor if you have a very, personal relationship with them, that they're using phone, video to treat you. But that definitely wasn't the norm until it became a necessity. And I think the pandemic is what forced that necessity, and also forced us to expect more from a telehealth encounter. So even for those who were using telemedicine pre-pandemic, I would say the actual technology of the experience was pretty rudimentary. You might have long wait times. There was a lot about it that, again, I would say didn't meet expectations. COVID really accelerated what we expect from those encounters, and really moved the needle.
Yeah. And so would you say COVID was one of the main pushes for telemedicine, or would you say it was already growing at this pace as a niche within medicine?
I would say it was already growing, not at this pace, but then COVID was the accelerant of the growth and the accelerant of the acceptance that this is the new normal versus this is an optional nice to have.
Yeah, thank you so much for that. I remember hearing telehealth for the first time during COVID, and I wasn't really sure what it was. And we've kind of seen it evolve in the last couple of years and think it's really valuable. So that leads us into the next section of this episode, which is diving deeper into telemedicine, what its pros and cons are, and maybe some points of misinformation related to the topic. So for this section, my first question is, when is it appropriate to turn to telemedicine versus trying to schedule an appointment with your doctor in person?
I don't know if the term appropriate, maybe the term appropriate is a little strong. So there's no inappropriate time to try to use telemedicine. I think given where the technology is at, there might be times where it is more or less effortless. But, I think as the field evolves, I would like to believe that we're always going to see care opportunities first through the filter of how do we do this with telemedicine, not do we do this with telemedicine. So I would say there's never an inappropriate time. There are just circumstances where the technology is more or less suited and fit for that encounter. For example, if you need, an emergent, time-sensitive medical procedure, and there's no specific technology yet designed for that to occur remotely, that's a less, applicable time to try to use telemedicine. But with planned procedures that there is a appropriate technology for it, designed perhaps specifically for that encounter, that would be, more relevant.
Yeah. And so it looks like the needs for both are very ambiguous. I think Rena and I had gone into this conversation thinking like it's a black and white list of like, if you have XYZ symptoms, do a telemedicine visit. If you have XYZ symptoms, do in person. So it's nice to know that it's not as black and white. When you're preparing for a telemedicine visit from start to finish, what does that look like? Is there a difference in how patients prepare for a telemedicine visit compared to like an in-person visit?
I think when we talk about preparedness, there are similar trends, meaning for an in-person visit or a telemedicine visit, you are best prepared if you have thought about what is required of you or what might be needed of you before you find yourself in an emergency. So, I wouldn't wait until you're very sick to figure out, okay, well, what platform does my doctor use? Or let me upload my personal, profile information like that about my medical history in this moment where I'm really not feeling my best self. So I think a lot of it comes from just being prepared in general. That helps you to optimize the experience, whether it's in person or whether it's through some telemedicine platform. I would say that the elements that you need to be prepared are probably very similar. You need to know what your insurance coverage is. Again, you need to know what medications you're on. You need to know how you feel about certain interventions that you may or may not want. So those are all things that come from thinking through that and gathering the necessary information ahead of time, whether it's through telemedicine or not. The only other element I would add is that with telemedicine, we'll call it the operational preparedness is a little bit different, right? So when you think about going to an in-person visit, the operational preparedness is questions like, do I know where to park? Do I have a ride that day? Have I brought my mask so I can walk in and, into the building? The operational preparedness for telemedicine is different. It's like, do I have a device that I can actually use to access my doctor. So I think there's operational preparedness in both, but the content of that is different when you're talking about telemedicine versus going in person. All of this it might sound very basic. I think depending on the patient's comfortability and usage of technology in general, that impacts severely, their comfort with the telemedicine preparedness piece. So if you're, like all of us, and you're on your computer all the darn time and you're used to using Zoom, et cetera, you might think, okay, well, that is very easy to translate all of that comfort into my telemedicine encounter. If you're someone who has never even ordered something off of Amazon, that's a different lift. So I think it's just knowing your tech comfort in general also kind of guides you as to how much you need to prepare before you get into a telemedicine visit.
Yeah, that's a great point. I think I have seen telemedicine appointments when I'm shadowing physicians or doing other things like that. And the technology piece can be a challenge for some people. So I think it's very good to know that there's sort of a learning curve and it's not exactly super user friendly if you're not used to technology, but that is good to know.
The same can be said for on the physician side, right? I think I am just now at least seeing training programming specific to telemedicine, right? Because if you have a provider that is not comfortable with technology, you end up spending more of the actual patient, doctor-patient encounter figuring out how to actually connect. It's really difficult to build, again, trust, rapport, to get efficiently through what you need to discuss from a medical perspective. If you're spending the whole time being like, close your browser, I can't hear you. Let's, you don't want your doctor serving as your customer support, your tech support, and troubleshooting your computer when you're supposed to be being evaluated for some medical problem. So I think that's the other part of it, which is we as a medical community have to recognize that this is, to some degree, part of the new normal. You're going to need to learn to figure out your tech the same way you know how to work your stethoscope and your other diagnostic equipment.
Yeah, this is actually a great segue into my next question, which is related to more of the diagnostic aspect of it. Since it is across the screen, it's sometimes really hard to know what tests to order or what lab work to get. And so we were wondering, how does telemedicine navigate sort of these more outpatient needs? Like, for example, Physician 360 will administer different tests for things like strep, flu, and COVID, but are patients able to ask for them over the screen with no questions asked? Does there need to be a more in-depth evaluation before these things are given out? How does that work in terms of Physician 360?
So for Physician 360, you've highlighted part of our goal, which is that there is a limitation to what can be achieved diagnostically when you are just having real-time communication with a medical professional. I would like to consider myself an excellent doctor, but at the end of the day, I rely on supplemental information to make predictions more accurate, right? So there is a reason why a strep test exists. It's because the clinical algorithms that we use have limitations, and that supplemental piece of information helps us get closer to a perfect, prediction about disease. So our motivation in including those peripheral tests was that we could take telemedicine a step further and again, make it that much closer to all of the elements of the traditional in-person visit. Not every telemedicine company does that. Not every telemedicine company feels that that's an important component of the patient visit, but for us, that was a high priority. The way that it works typically is that there are some conditions where the patient ends up taking the test first, and the doctor is really using the result of that test as part of the snapshot of what the patient's going through. And then they're interpreting that result in addition to other information from the patient and prescribing treatment based on the result. There are other tests, however, where just to take the test, you have had to provide the doctor with enough information that they feel it's medically indicated. And then essentially they order that test for you. So it really, it's somewhat condition specific. And it really depends on the type of test as well. So something like, for example, a urine, analysis, that's something that is an over-the-counter test, and a patient can choose to take that test without an order from a physician. Then there are others that are either lab-based or pharmacy-based, and those typically are ones where the doctor has to say, I think this is medically indicated first. I send an order for the test to be performed, and then I'm reviewing the result and prescribing treatment based on it.
Yeah, thank you for that clarification, because I feel like this really shows telemedicine in a larger ecosystem within healthcare and how ultimately you're getting the care that you need. And when we were doing just a brief kind of media research of like what their opinions are of different people about telehealth, we came across a couple of articles where people expressed a lot of fears or almost antagonism of like, telehealth is going to take over health as we know it, or healthcare is going to be reduced to Zoom screens. And we know that that's not true, but we were hoping that you could comment on this a little bit to help people not be so fearful of this misinformation.
I truly believe that the only way that healthcare would be, to use your quote, reduced to, Zoom screens is if we as a culture, as a humanity, don't allow our regulatory and reimbursement policies to keep pace with the technology. So there is no shortage right now of very innovative technology that is being brought to market as it relates to healthcare, whether it's anything from, your Apple Watch to, again, remote powered robotics for complicated surgeries. The tech is there. The innovation is there. It's a matter of us saying, let's wrap around that technology processes that get our clinicians properly reimbursed. Let's wrap around that technology regulatory processes that allow us to use that technology in a compelling way. I think if we embrace the concept of telehealth in broad strokes with those policies, then we will prevent ourselves from being limited to just a Zoom encounter with your doctor. And we will see, it's like a flywheel, right? The more we have supportive processes for health tech, the more health tech gets built and the more sophisticated it gets. And it's a cycle that perpetuates. So I think it's more about embracing the change, which I know is uncomfortable for all of us as humans. We don't, not all of us love that, but if we can embrace that change and do it in a safe and modulated way, then I think we're going to see in a very short amount of time, we're going to be very far from just Zoom screens. We're going to be full-blown hospital at home.
Yeah, that's very cool to think about. And I know in the beginning we were talking about how telemedicine is still fairly new. I mean, I'm not sure how old it is exactly, but it's changing rapidly, and it is good to be aware of those changes. And speaking of things changing so quickly, I think a lot of people have concerns about how accessible this sort of platform will be as it evolves. So how accessible would you say is telemedicine from like a cost or a target population stance? You were mentioning insurance plans earlier. Some insurance plans don't cover telemedicine visits, some do. Is that sort of creating a divide between people who want to access telemedicine, but they can't?
To address issues of accessibility. Just by the nature of what telemedicine is, a patient can be in one physical place and their clinician can be in another physical place, which definitely helps with certain issues of accessibility when you have patients who have limited mobility or if they have transportation challenges. Telemedicine is definitely helping with accessibility. I think, however, it's just as important to note that although it's helping, we still see disparities within the usage of telemedicine. So if you think about vulnerable populations like Americans living in rural America or in tribal America, 20% or so of those communities still don't have access to broadband internet. So when we talk about telemedicine being an option for patients with limited accessibility, that is true, but not necessarily equally true for everyone. So it's important to recognize that there is still some degree of disparity. Same thing when we talk about telemedicine being a more affordable option, especially for patients who are uninsured. We still have, close to, I think, 10% of adult Americans without insurance. So there's a disparity there. Not every telemedicine platform is going to service you, for example, if you don't have insurance. While it does help address some of the accessibility issues, it is not 100% effective at containing healthcare disparities. And I think just acknowledging that is important, and then figuring out a way to design telemedicine options with broad user profiles in mind. So designing your platform so that it can function in a place where there's not technology infrastructure, or designing it at a price point that might be achievable for someone with and without insurance. So there's a lot we can do there, I think, to close disparities, but it starts with recognizing that telemedicine is not a perfect solution for all of our healthcare disparities around accessibility.
Yeah, I think really this is prime example of how the determinants of health are very comprehensive and go across many sectors of your life, especially when we're talking about the accessibility piece. So I really appreciate your honesty of how telemedicine is very helpful, but is not a perfect solution in and of itself, because I think that is what is going to help us honestly improve it more and more to make it more equitable. So I guess in that similar vein, are there any recent developments in telemedicine that seem promising, whether that be from a technical standpoint or maybe from an accessibility standpoint?
There's so much going on in this space. I don't even know where to start. I would say that in the most general way, just the capacity of telemedicine has increased. So we're seeing platforms and clinical networks that used to be able to support a few visits per day can now support thousands. So I think there's an increase and an adaptation of the capacity of most platforms, which is really encouraging. I think there is, as I mentioned before, no limit to the amount of peripherals that are now being incorporated and wrapped around those basic technology platforms. So when you look at wearables and other devices where data from them is now being included in your health record that your physician can interpret and action off of, I think that's incredible. Specifically around big data, being able not only to gather more information from that individual, but to be able to gather it and then see in the context of thousands of other patients who we've also gathered that data from, and being able to use that to, increase clinical predictability. That piece is really exciting for me personally, because I'm an emergency medicine physician. Part of what I find most interesting is this concept of hospital at home. So taking more and more technology that is traditionally found only within a hospital setting that addresses acute conditions and time sensitive illness, and putting it in the home, figuring out more and more ways to get it into your home. I think that part is going to be, in the next few years, a place where we see a tremendous amount of development. So I honestly envision that we will be, same way you have a first aid kit at home right now that has Band-Aids and, a bunch of other things that may or may not be actually useful. But I I do envision that we will all have, we'll call it the modern day medicine cabinet. And within that is advanced level medical technology. And rather than calling perhaps 911 and having them come to your house, maybe you're still calling 911, but you're able to now bring that medical expertise into your home, say through your cable provider, and they're going to guide you as to how to use these medical devices that are already in your house. I really believe that we're moving in that direction. So I think we are living in a very exciting time where the technology is moving so quickly. What we see in just a couple of years will be dramatically different than what we see now.
Yeah, the thought of that medicine cabinet at home idea is really cool. And I think it could help so many people and save people a lot of money as well. So, my last question for this section of the episode is related to patient privacy and sharing information. I was wondering what sort of protections are in place for telemedicine that to make sure that people's data is secure. So how is patient privacy being protected through these platforms?
There are a lot of protections that are in place, both for in-person visits, and then there is a telemedicine component of every one of those protections. The one that most people are familiar with, they have at least heard of HIPAA. So making sure that the platform that you're using has an attestation to say that it was built with privacy in mind, that it's meeting certain criteria so that it has its HIPAA certification. I think that's the most common one. I think one thing that maybe is less obvious to people, although now we talk about it in other elements, in other industries, and so perhaps more awareness within healthcare too, is just around who owns that data. So not only is the company keeping it safe and private and appropriately, housed, but who owns it ultimately, and what are they doing with it if they have access to it? So I think, there's been a few big privacy acts that have come out recently, and at least regulatory changes that force companies to at least be very transparent with patients about what they may or may not do with their data, even if it's de-identified. So I think the biggest protection that a patient has, first and foremost, is just being informed and aware of what to look for and what questions to ask. I think at this stage of the game, most companies are taking the proper precautions to make sure, again, that the data is stored in a compliant fashion. But I think it's really about awareness and knowing as a patient what your rights are, and being selective with sharing your information with companies that have practices that are ethical.
Yeah, thank you for sharing the important components and privacy that we need to consider, and really just providing such an in-depth and thorough overview of telemedicine. I'm sure all of our listeners are going to walk away with a clearer understanding of the services and its pros and areas of improvement. But now we really want to get into Physician 360 and really jump in and give it some space on this episode. And so I want to ask, how did Physician 360 get started? What were some of the goals that you had envisioned when you were thinking of starting this company?
I know it's only a few of us here today, but if we were with an audience of people and I asked everybody who had ever been to an urgent care to raise their hand, we'd probably see, I'd say 30 to 40% of the audience raise their hand. And if I asked them to leave their hand up, if they walked away from that experience and would have given it a 5-star review, we probably would see no hands left in the audience. And so, I am an emergency medicine doctor. I trained for a good chunk of my life to be able to provide excellent care to patients. It becomes pretty soul crushing when you want to do that and you see people waiting 6+ hours to see you and then walking away with a really large bill for something as simple as a throat swab. So it didn't take me long before I was pretty frustrated with that and felt that there must be a better way to do it. And what I realized in trying to create a better model, one that was more affordable, more convenient, and could still deliver high quality and safe care, was that there is a network of community pharmacies in this country that is completely underutilized. And that became very clear in COVID, right? We said to the American people, go to your local pharmacy to get your vaccine, go to your local pharmacy to get tested for COVID. And it became pretty obvious to me that, well, if we can do it for COVID, why can't we be relying on these pharmacies for a variety of other clinical services? What's amazing about community pharmacies is that they're everywhere. So there's a community pharmacy within a few miles of over 90% of Americans. So when we start talking about things like equitable access to healthcare, leveraging that pharmacy footprint just made a ton of sense. So that's essentially what Physician 360 does. We go into these pharmacies, we provide them with a software platform that allows the pharmacist to share information about their patients with a network of doctors, so that a patient essentially can walk into a pharmacy. They don't need an appointment. They can take a test, for example, like a strep test. They interact with the doctor on their smartphone, who can see the result of that test. And then the amoxicillin prescription is sent back to the pharmacy all within 30 minutes. And in doing that, in giving the pharmacy these tools, we are upscaling them from a place where you historically just pick up meds to a place that is a comprehensive care destination. It's like the next generation of Minute Clinic, but a virtual model.
Yeah, that's really great. And this is such a huge problem across the country where people can't get appointments in time. And so it's really cool to see that these kinds of platforms are on the rise and helping people get a better access to care. But this is also a really big need to fill in the industry. And it seems very challenging to approach. So we were wondering, what are some lessons you've learned in attempting to fill such a large need within healthcare and public health?
I would say that one of the lessons I have learned is that sometimes the solution to a problem is not about inventing new technology. It's about taking what exists and using it in a creative way. So we didn't invent the concept of telemedicine. We didn't invent the concept of community pharmacy. We didn't put a community pharmacy strategically on every corner, even in, again, vulnerable populations like rural communities. But what we did was look at what existed and connect the dots in a new creative way. And I think that to give patients equitable access to care in a more resource efficient way than trying to completely reinvent the wheel. And so that has been a big lesson learned, that sometimes it's about looking at a problem through a different filter than it is about creating new technology.
Yeah, and I think especially in an industry or really in a society that's constantly rewarding innovation and state-of-the-art solutions, I think there's something to be said about, like you said, not reinventing the wheel, taking what we have, but using it maybe a little bit more efficiently. And I guess to me, that is what makes Physician 360 unique from other telehealth or telemedicine providers or platforms. But I'd also love to hear from you how you see Physician 360 being different from other competitors or other entities in healthcare.
I think the two biggest differences are, and we alluded to this earlier in the conversation. Number one, we really put an emphasis on creating a comprehensive visit. I want to believe that we're offering our patients through telehealth a comparable experience to what they would have had if they went to a traditional brick and mortar medical appointment. And so we have gone to extreme lengths to try to incorporate diagnostics and testing and other peripheral data inputs whenever possible. So I think that's one big difference, is we are essentially offering a comprehensive medical appointment, in a box. And the other is really about the pharmacy relationship. We recognize that their footprint is what allows us to achieve almost universal accessibility. The pharmacist is the most learned, the most educated on medication therapy for patients. We want to elevate that and give them a way to participate in the care team. So our roping in the pharmacy, roping in the pharmacist, leveraging their expertise, leveraging their footprint, I think that has made our model dramatically different than the others that are out there.
And that's incredible, really, because I'm thinking about my healthcare experiences. And I don't know about you, Rena, but when I go to a pharmacy, I just take my prescription and leave. I cannot recall really taking the time to interact with the pharmacist or really even reflecting on what they are contributing to my healthcare experience overall through their credentials. And so you mentioning that Physician 360 is really working on uplifting them to be more active in your healthcare experience. Wow, I didn't think about like the important role that they play besides just giving us our prescriptions. And maybe that's very obvious, but not to me.
No, I don't think it is. And I think pharmacists, again, I wouldn't, if you showed me a rash, I could tell you, okay, this is what the rash is, and this is how I would treat it. Let's say that first line treatment doesn't work, and there is another compounded medication that might be a better fit. I'm not going to know that. As a physician, that's not my area of expertise. That is the pharmacist. But we have not, as a culture, really recognized how valuable that insight is. And we've never given them a great way, in my opinion, to tie in that expertise to the care journey. So to your point, what we're trying to do is say, the pharmacist is in front of the patient more frequently than any other healthcare stakeholder, because people, again, are there, they're picking up their meds. How do we make that moment where they're picking up their meds way more valuable to the pharmacist, given everything they know, and way more valuable to the patient? And so, I think it's about connecting the dots.
Oh, yeah, truly. I mean, just this morning, I went to visit a specialist who had given me a brand new prescription. And when I went to pick it up at the pharmacy, it was my pharmacist that was like, hey, you also take these two medications. Just know you shouldn't take them within like 3 hours of each other. So take one in the morning and take one at the night. And I like wouldn't have known if my pharmacist had not stopped me and went like, by the way, just so you know.
Yep.
So what a valuable piece of information. I'm glad that this was brought up in the conversation. We're super excited to see where Physician 360 goes and wish you the absolute best with all of your future endeavors. So this concludes our conversation. To our audience, we hope that this episode empowered you to understand aspects of telemedicine. And for more information about this episode and to further read about this topic, please visit our website at withthepodcast.wordpress.com. To share your thoughts and to interact with us, follow us on Instagram at withthepodcast. We appreciate your support, and thank you to Dr. Angela for taking the time to talk with us. We hope you will join us for our next episode.